Hello, my name is Franklin Tai, and today we learn about medical imaging. Before the 1800s, it's all about drawings and sketches, but in the late 1800s, it's about surgical imaging methods. So today we'll be learning the 5 medical imaging, which is 1 X-ray, 2 CT scans, 3 MRI scans, 4 PET scans, and 5 ultrasound scans. Now let's start with the first medical imaging, which is X-ray. So in 1895, this guy named Wang Roten discovered X-ray, and the first image was his wife's hand. In 1901, he was awarded with the first Nobel Prize in physics. An X-ray is high energy radiation with short wavelengths and it penetrates solids. And using X-rays is really harmful because it could damage your cells with risk of cancer. And these are images of the X-ray. So the gray part is the soft tissues, and the white parts are the bones and teeth. So now let's start with the second medical imaging, which is CT scan, which refers to computed tomography. So it images sections that combines many cross X-rays with using a computer. It was invented in the 1970s, where the scanner can rotate 360 degrees with the patient to create a 2D picture, 2D slide. It is best for tissues and can measure structures down to a millimeter. But some disadvantages are that it can increase cancer for children when they use it multiple times, and the radiation dose is much higher than standard X-rays. 2D images of the brain.
Hello, my name is Emily, and I'm going to present on magnetic resonance imaging, or as well as MRI. So MRI is a non-invasive medical imaging technique that's first used in the 1980s. And by non-invasive, that means we don't need any wires attached to the patient's body while using this method. It uses a powerful magnetic field, radio waves, and computer detailed pictures to look inside the body. It gives precise imaging when it's used to examine organs, tissues, and skeletal systems in our body, and especially used to detect tumors and cancerous tissues. And it does not expose the patients to radiation. So it does have its drawbacks. It costs higher than other medical imaging techniques, and it takes a long time, and the machine makes too much noise, so it may cause discomfort in a lot of patients. Because it needs a magnetic field to scan the pictures, magnets are involved, and so patients with metallic implants shouldn't be taking this type of imaging scan. Hi, my name is Han. I'm going to introduce you about PET. PET stands for positron emission tomography, which is a type of scan that have a doctor to see what happening inside your body, not what it just look like. Unlike a regular CT, X-ray, or MRI, only show picture of organ or bones. PET is also shows how the organ actually working, how blood is flowing, how cell is using energy. How it actually works before the scan. Special radioactive substance injected into the patient body. The substance travels through the body and go to the area where there's a lot of activities, fast-growing cancer cells. PET scanner then detect the radiations from those areas, creates an image that shows where the activity is actually happening. This is the PET scan brain to show the activities in the brain. What can't you bring or wear during the PET scan? You cannot wear the metal objects, and also you have to wear comfortable clothes, wear loose, comfortable clothes without metal. You might be giving a hospital clothes to wear instead. PT scan also happen chemotherapy. Before the treatment, doctor use PT to scan to see where's the cancer actually placed and how much it has spread. And during the treatment, PT can show if the chemotherapy is working. If the cancer cells are dying, they will have less activities in the PET scan. After the treatment, the PET scan help check if any cancers is left in the body or if it has come back. Why is PT so helpful in hormone therapy? It can track progress in real time instead of waiting a week or months. Have a doctor change or adjust treatment quickly if it's not working. And the last one is it's more accurate than some other scan because it shows how the cancer is behaving. It's not just how it's looks. For a simple example, think of PET is a heat map of your body. Cancer cells light up because they use a lot of energy and they stop glowing after the chemo, so it's a sign the chemo is working. Ultrasound is a medical imaging technique that uses sound wave to create real-time images of what's happening inside the body. No radiation, just sound, safe, painless, and non-invasive. So think of an ultrasound like a sonar of submarines. It sends out the sound wave, listen for the echoes, and then draw what is heard. Unlike X-ray or CT scan, only show a static picture. Ultrasound scan shows the real-time movement, like a video of your organs work. The technicians applies a special gels on your skin, where the ultrasound will be done. Gels is a water-based and is have to ultrasound to waves pass and smoothly between transducers, the device, and your skin. The common use of ultrasound is in practices like see how the baby grows or the heartbeat, the blood vessels, the muscle and soft tissues. Here's the picture how the ultrasonography works. The medical people will use the ultrasound to scan patient's stomach to see where's the baby, how the baby is growing, and the heartbeat of the baby.